Hello. This is like the third or fourth time that I've attempted to do this video, so I've already reconstituted, but I'm going to start with the demonstrations first. And even though I've already mixed the powder, I'm going to go step by step and show you exactly how I would do it if I had not done that already. So with reconstituting medication, I'm reconstituting a powder with sterile water, saline, or lidocaine. The packaging on the powder will tell me exactly how much of what to use and how much my total volume. So this one wants 3.2 mils of sterile water or lidocaine for a total volume of 4 mils. So depending on hospital policy, I would have a second nurse with me just to verify everything or if I had any concerns. So I would get all my supplies, perform hand hygiene. I'd pop the tops off of both bottles. I would wipe the tops of the bottles for 10 seconds each, just to make sure there's no bacteria and it's all sterile. So give it 10 seconds. Then I'm going to take my syringe, open my needle, and I would take my syringe, attach it to my blunt needle. Again, make sure everything stays as sterile as possible. For my patient, I would attach it. I'm not going to, seeing that I've already mixed everything. So I need 3.2 mils, it said, of the sterile water. I'm using saline because I didn't have sterile water. So I would pull it back to 3.2, just so you see. And then I would forcefully push it into the sterile water, push all that air in, and then I would flip it over and let it pull back 3.2 mils of the solution or sterile water. And I will show you that. And make sure there's no air in this at all. I'd take my powder and I would again forcefully push it into this all the way. I'm going to agitate my medication. I'm going to make sure I read the bottle first so I don't forcefully agitate it if I'm not supposed to. Once it's all mixed together, it will turn clear, which this has. And then I'm going to pull back the full 4 mils like it said. And then pull it off. And that would be my 4 mils. And then I would label my syringe and take it, I would administer it to my patient. So that is how I would do it. Sorry, I already reconstituted it. So setting that aside, the next thing is demonstrating how to properly mix regular insulin and NPH insulin in one syringe. So this is my NPH. This is going to be my NPH. This is going to be my regular insulin. Again, make sure I have all my supplies. Make sure I have a second nurse with me to do everything. I would pop the tops off, and then I would clean both the lids for 10 seconds. So then I'm going to take my needle, take the cap off. I need 10 of the NPH, so I'm going to pull back air to 10. I don't know if you can really see that. And then I'm going to gently but forcefully push into this and put 10 mils into that and pull out. Then I'm going to pull back 5 mils because that's how much of the regular insulin. Again, pull back 5 mils, and then I'm going to push it into my regular insulin, push that out. I'm going to pull back 5 mils, and then I'm going to have the second nurse double check. So 5 mils, pull it out, and then I'm going to go back to the NPH, clean my top off, and push it in. And I would flip it over and pull back 10, which would put me at 15. And then I'm going to, again, have the nurse check that I pulled back 15, pull my needle out, and then I would pull this little cap up so that it's safe, and I pull it all the way up so that I couldn't poke myself, label it, and take it to my patient or administer it if I was in the room already. Again, and I would always have the nurse check what I'm doing step by step. So that is the insulin. This was my NPH, this was my regular insulin, and that's how you do that. So moving on. Starting with number 1, explaining the IM needle length and gauge for adults, walking child older than 2 years old, and newborn infant small child less than 2. So for an intramuscular, the deltoid muscle on an adult, the length would be 5/8 to 1 inch of the needle, and the gauge would be 23 to 25 gauge needle. With the needles, the smaller the gauge, the bigger the needle. So 23 to 25 is pretty small. That's what we actually use to draw blood on newborns. So for the vastus lateralis muscle, the length of the needle for the IM injection would be 1 to 1.5 inches, and the gauge of the needle would be 19 to 23. For the ventrogluteal site, which is the preferred site in adults for IM injections, the length of the needle is 1 to 1.5 inches, and the gauge would be 19 to 23 inches. I'm sorry, 19 to 23 gauge. So for newborn infant small child less than 2, the vastus lateralis muscle is the only location for an IM injection, which is your middle or upper thigh. And the length of that is going to be 5/8 to 1 inch for the needle, and the gauge of the needle would be the gauge of the needle would be 23 to 25 gauge. A walking child older than 2, you can do the deltoid muscle, ventrogluteal site, or the vastus lateralis, and the length of the needle would be 5/8 to 1 1/4, and the gauge would be 23 to 25 gauge needle. So for subcutaneous or sub-Q and intradermal injections, for intradermal injections, the length of the needle is 3/8 to 1/2, and the gauge would be 25 to 27 gauge needle. For sub-Q, the length of the needle is 1/2 to 5/8, and the gauge would be 25 to 27. So, explaining the importance of a filter needle, I have actually seen these be used quite a bit. I've assisted on a lot of bone marrows, and I help the doctor hook it all up because you have to keep a sterile environment. They still have these lidocaine ampules in all of the bone marrow kits that the doctor uses to numb the injection site for where he's going to do his bone marrow. And so these are all glass. This blue area right here, you would break it off. There's always a chance of shards dropping into the medication. So what the filter straw or filter needle does is it filters out any of the shards that could have possibly dropped into the medication. It filters it out, so when you're pulling your syringe back, you're not getting any of those shards. So it ensures that you're not going to be injecting any shards of glass into your patient, because that could be very dangerous. So that's the importance of that. For identifying the intramuscular site selection for adult, child less than 2, infant, or older child older than 2. For the newborn infant small child, the vastus lateralis muscle is the only site, which I actually made this. So the vastus lateralis, you're going to make a square with your hands on the upper thigh portion of the child, and it's on kind of on the outer side. That's the meatier part of the leg as well, and that's where the injection site would be. So you would kind of make like a square on their leg. So for a walking child or adult older than 2 or an adult, the deltoid muscle is up here. You're going to feel for this little notch on your shoulder, and it's going to be 2 fingers down in your upper arm. For the ventrogluteal site, I made a little chart right there. So you're going to look for like the pelvic crest or iliac crest right there. And then you're going to also feel for the femur down here. And you're going to make a V with your hand. And right in the middle, so if my hand was kind of like, say that's their whole thing. Right in the middle of that would be where my injection site would be. And then for the vastus lateralis muscle, like we explained, it's going to be on this outer portion of the thigh. So identifying the intradermal and subcutaneous site selections. Intradermal, the inner aspect of the forearm, which would be this section up here where you get your TB injections. the scapular area of the back, which would be right here. Also the upper chest, which would be up here, or the medial thigh in this vicinity right here. For subcutaneous, you would do the fatty tissue of the abdomen. Just make sure you avoid like the umbilicus or belly button area. That would be where you would give like insulin or the low dose heparin. There's also the lateral, right up here, the lateral posterior upper arm or thigh, and then also the scapular area of the back and the upper ventrodorsal gluteal areas as well. I've had some injections up there and that's not very comfortable. So that is pretty much it. I'm sorry I kind of messed up the reconstituting the medication, but yeah. So I hope this was good. Thank you.